Welcome back to With the Doctor, and I'm your host, Dr. Abhishek Papneja. And in this video, I want to discuss what a herniated disc really is. So what is a herniated disc? Well, a herniated disc is also known as a slip disc or a bulging disc. So imagine if these two hands were to represent your spine. Now, your spine is not touching itself, right? The bone in the back of your body is not touching itself. It has a gap, and that gap is maintained by a sac called the disc, right? Now, if that disc or the bones lose structural integrity, meaning that you have atrophy of the bone or you have dehydration of the disc or even fracture of the bone, you can essentially have a structural abnormality which would allow this disc to move out of its normal place. Now, when that disc moves, that is a herniated disc, a bulging disc, or a slipped disc. Now, just because you have this doesn't mean you have symptoms. To have symptoms, you have to have some form of neural tissue getting disturbed. So what do I mean? Well, inside your back, right, inside these bones, you have a canal. And that canal carries the nerves from the top of the head all the way down to your butt. Now, these nerves have to exit this canal, exit the spine. Only if they exit will you have coordination of hands or sensations. You will also get the function of your internal organ system. So this structure is very important, you can imagine. A small kink somewhere can mess up your heart, can mess up the hand coordination, can mess up the entire organism if it has to, right? You can get complete paralysis if you have an injury at your cervical area because anything below is damaged. Why do we have symptoms? Well, as I mentioned, these nerve roots have to exit. When they exit, if something is irritating them, you will have symptoms. Now, what are symptoms? Well, symptoms are anything that would be related to that nerve root, right? If it's a cervical herniation, well, you could have weakness from that point and below. You could have hypertonicity, meaning that your muscle strength is increased or the reflexes have increased, or you can have complete loss of reflexes as well. You can have increased sensation, right? And that's usually when you start feeling the pain, or you can have complete loss of sensation. You can have other systems involved as well. We're just talking about the muscle and the skin right now, but there's other organs involved as well. Now, if the herniations are towards the sides, the nerve roots will be involved. Now, if the herniations towards the center, you can get the entire spinal column to be involved, and that's even more severe symptoms. Now, what would happen if these nerve roots get damaged? Well, you can imagine the brain's responsibility is to control this entire organism, whether it's you breathing, whether it's your heart ticking. The entire body is dependent on this nervous system. Now, so are your limbs, right? So most symptoms that most people will present with are either sensory or muscular problems. They will not present with those organ system problems. So, what symptoms are we actually looking for? Well, that's the tricky part. Because since nerves innervate the muscle and they innervate your skin tissue, we can get any symptoms from excitation of the nerve causing increased tone, increased strength in that area, or we can get damage to the signal causing loss of tone, loss of strength, loss of reflexes, right? At the same time, we can get loss of sensation, or we can get increased sensation, or we can have simple pain sensation or a stretching, pulling sensation. So you can imagine, because there are such vague symptoms, most probably if you're gone to a physician for these complaints that you're having, some neck pain or some back pain, you're probably going to be diagnosed with a muscle spasm or something, which is quite possible because since your nerves are being hyperactive because they're being impinged on, the muscle where the nerve root is going is getting overly active and it's contracting, right? And at the same time, the body has a defensive mechanism that it doesn't want those nerve roots attacked or impinged by that bulging disc. So it will use the muscle in the area to try to stabilize the spine, and that would also cause a muscle spasm. So most common diagnosis from the physician would be a muscle spasm. And you will be prescribed some drugs which may actually help. So now that we have a basic idea of what a herniation is and a basic idea why the symptoms occur, now is how do you diagnose it? Well, like I said, the symptoms are so vague, the diagnosis is difficult. But there is one sure thing. If you are severe enough in your pain, be assured it's quite possible that you do have a herniated disc and not just a muscle spasm. If you're like me who walked into the doctor's clinic and you were told a muscle spasm when you could not even lift 1 pound of weight, when you could not sit down, you could not sleep, you could not stand up, you could not, go to the restroom, you could not do anything, and you're being told that you have a muscle spasm, it's quite possible you're having more severe symptoms from a herniated disc. Now, a good way to diagnose it, well, if you're in the severe category, good for you. You got a possible sure diagnosis. Can only be confirmed with an MRI. The other way, if you're not severe, if you have like a mild herniated cervical disc or a lumbar cervical area problem, a good way that you can put into calculation that you have this herniated disc would be to do a flex test. So why would I do a flex test? Because when your spine flexes, so flexation would be my head going forward or my back going forward. That is what a flexation is. An extension would be this, or like this for the lower back. So when I move my spine, you can see what is happening. If I flex my spine like this, the anterior, meaning the front portion of the spinal bone, will meet. And when that meets, there is a pressure production in the front over here. That pressure will push backwards the disc. Since you've lost structural integrity, that disc will not stay within the space allotted. It will move to any openings available, which would be the foramens where the nerve roots exit, and you will get a sensation. Now, what sensation? After close observation, what I've realized is the sensation that you will feel is a pulling sensation. So you can probably concur with me, is that you have pain right around the spinal area. You probably got an x-ray of your spine and it's absolutely normal because there's nothing wrong with the spine. The problem is the disc is herniating. So, without an MRI, which you probably won't get because your health insurance won't cover it and it is not protocol, a good way to test if you have this problem would be to flex. Now, when you flex, like I'm flexing right now, I am feeling a pulling sensation right here. So wherever the hernia is, when you flex, you'll feel a pull, because that nerve root is being impinged and is not getting space in its allotted area to adjust itself for the movement of the spine, right? So you can then you might actually call it like, oh my God, I have tense muscles. No, you don't have tense muscles. What you're having is the nerve root being activated, causing the muscles to get stressed out. Right? If the nerve gets irritated, you will have symptoms. They could be muscular with increased strength or increased spasmicity, or loss of strength, loss of reflexes, Or you can have sensory problems, which would be increased sensations. They're hyperactive. You can feel something's crawling here, or you touch it and it's really sharp, or you get pain, or you have no sensations at all. Remember, so look for these symptoms and you can have a close enough diagnosis. The only way to officially diagnose would be to get an MRI. But now I hope you guys have a basic understanding of what a herniated disc is, how to diagnose it, and if you have any further questions or concerns, please leave a comment in the bottom. And before you do anything, go talk to your doctor, speak to specialists of their own fields, get an opinion, make an educated decision, and reach out to me if you want any help answering any other questions. And if you like the video, please hit the like and subscribe button and join me for my next video. Thank you.